Hello, everyone, and welcome. It's another Sunday, and I am back. I'm Dr. Val, an integrative sleep medicine doctor and women's sleep expert, here to talk all about fibromyalgia and sleep. And I'm just going to do a quick mic check, sound check. If you are here, let me know. But yeah, I had to change up my mic. So hopefully you can hear me going live. If not, I will just record this again for you when it works. Okay. So let's just get started. What is fibromyalgia? So I'm sure if you're watching this, you know what it is because you probably wouldn't have clicked on the video if you didn't, or one of your friends or family love member, someone you love, potentially has it. So fibromyalgia, it's a really interesting condition. And I think we certainly know a lot more about it now than when I first learned about it in medical school. And we think of fibromyalgia as a condition where your brain processes pain a little bit differently and you're really more sensitive to pain. So let's see here. Okay. So it's really it's a chronic condition and it affects women certainly more than men. And a lot of people who have it have a lot of fatigue and difficulty sleeping. And we don't know for sure what causes it, but there certainly is a genetic component. Like I said, it happens more in women than in men, and especially as we get older and go through midlife. And certainly menopause can make a lot of these symptoms worse. There is no cure, at least at the moment, but there are things that we can do to help improve and manage your symptoms. And treatment involves a combination of things, some movement therapy, treating sleep, some cognitive behavioral therapy, and also some medications as well. So, when we think about a condition that can affect multiple systems in your body, oftentimes when people who have fibromyalgia, when patients have it, they go and see their rheumatologist, which are doctors specialize in autoimmune conditions that affect a lot of times the bones, the muscles, but also, there can be systemic effects with other rheumatologic conditions like rheumatoid arthritis or lupus. Um, the question now is fibromyalgia really a sleep condition? And the reason I propose this is because up to 90% of people who do have fibromyalgia have difficulty with their sleep. And if we can improve their sleep, guess what? A lot of their symptoms can improve because some of the symptoms include pain. And when you don't get enough quality sleep, your threshold to handle pain goes down. The pain can be all over your body. I think, I was looking it up earlier, but there's something about what I learned in medical school about like 18 or 16 different points that you touch it. And if it's positive, it happens on both sides of your body. But it doesn't seem like we characterize that anymore. Anyone out there? No, just let me know. But symptoms, yeah, definitely pain sort of all over the body. Sometimes the pain is described as burning, aching, throbbing, fatigue, just tired all the time, regardless of how much sleep that you get, and also difficulty sleeping. But beyond that, you can have some numbness or tingling. Brain fog is really common. Fibro fog, people call it. Sensitive to light, noise, temperature, and digestive issues as well. So is fibromyalgia a sleep condition, a rheumatologic condition, or even a psychiatric condition? Because along with this can come mood disturbances like depression and anxiety. Like I said, more than 90% of people who have fibromyalgia have disrupted sleep. And so what this looks like, we've actually done studies in the lab where folks with fibromyalgia have difficulty falling asleep, staying asleep. The quality of their sleep isn't as good. Their efficiency, how much time they actually sleep, is less compared to those of control. And there's an interesting phenomenon called alpha intrusions, which basically your brain waves are going faster when you sleep. So you're having a lot of arousals or awakening throughout the night. And that really can impact how well you feel in the morning. So being a medical sleep doctor, I always encourage people to rule out any underlying medical sleep condition. And the biggest one really is obstructive sleep apnea. So you take a look at the people who have fibromyalgia and also the people who could have obstructive sleep apnea, right? They can go hand in hand because as you get older, your muscle tone decreases, especially in the upper airway, and that makes it more floppy, which can predispose you to having obstructive sleep apnea. And if you're not having good quality sleep, right, then that can affect your pain, your energy levels during the daytime. So data is really all across the board in terms of how many people with fibromyalgia have sleep apnea. Age is a big factor, but some of the research shows that up to like 80% of folks with fibromyalgia who come to a sleep clinic have it. Maybe around 40% of people who see their psychiatrist, maybe even less that see their rheumatologist. But it's a wide range of people, but it's something to worth testing for because it's really common, especially depending on your age and your menopausal status. Restless legs is another one. Sometimes you can't fall asleep because your legs bother you. Is it because of pain, or could you have an underlying condition such as restless legs, which is associated with genetics and low iron levels? And interestingly enough, another sleep condition called narcolepsy. Um, Patients with fibromyalgia could actually have narcolepsy, and there's pretty good treatment options for that. So narcolepsy is a condition where your sleep stages are really disrupted. You don't go in the normal order. You're awake or asleep. You're in REM and non-REM sort of all at the same time. And the way we diagnose this is with an overnight test in the lab, a polysomnography, and then the napping test, which is called the MSLT. So if you're really, really tired all the time, and it's not just fatigue, you really need to go and lie down and you have fibromyalgia, talk to your doctor or your healthcare provider about getting a PSG MSLT, the test to rule out narcolepsy. So how do we treat someone who is sleepy and has narcolepsy or an underlying sleep condition? Well, number one, rule out a medical sleep condition, right? The ones I just talked about, obstructive sleep apnea, restless leg, narcolepsy. The second is, what are the different things that we can do to help improve someone's sleep quality, right? Talk about sleep hygiene. Are you drinking too much caffeine or too much alcohol? Is your bedroom environment dark, quiet, and cool? Is there a lot of environmental noise that's impacting the sleep that you're getting when you're trying to fall asleep, right? Because it's almost like you already have the cards stacked against you. Can you focus on what you can control within your environment to help improve the quality of sleep that you have? Behavioral therapy, cognitive behavioral therapy can be super helpful. The thoughts you have about your condition, the thoughts you have around sleep. And then even looking at certain medications. I actually had a patient recommend a book called The Fibro Manual by Dr. Lipton. I'll link it in the description below, but she actually is a physician herself who went through and has concerns with fibromyalgia and wrote a really good book about it and talks about, the different medications and how they certainly can help. So I would say if you are someone who has fibromyalgia and you've already, ruled out your sleep apnea and the underlying medical sleep condition, done everything you can to improve your sleep hygiene, and you're still having difficulty sleeping. I often don't give medications to patients, but I would certainly say for sleep, in this instance, it probably would be indicated because we really want to make sure you're getting enough deep sleep, enough restorative sleep. If you're constantly in the light stages of sleep, it can really impact your mood, your ability to tolerate pain. And sleep is so restorative. Yeah. Other things to consider are your lifestyle, right? So, more and more, I'm learning about, and really have been interested in nutrition for a long time. Actually, I even thought about getting a degree in nutrition or even going to culinary school, but medical school called me, so I went down that route. But there have been, pretty decent studies about fibromyalgia and people with fibromyalgia and the type of food that they eat. So in 2017, there was a study that looked at how food can influence your mood. And they looked at about 486 folks with fibromyalgia for actually 1 year. So that's a pretty impressive study. It's a really long time. So we can get some good data from that. And those who ate more fruits and veggies, guess what? Yep, fruits and veggies are good for you. Your mom was right. Your grandma was right. And even fish had better mental health, right? So if you have better mental health, right, you can sleep better, and hopefully that'll help you handle pain better. And what it looked like was 2 to 5 servings of fish had the best results. So if you like to eat sushi, I love sushi. It's sort of my favorite thing. Maybe that can help. Those omega acids, right? Those fatty acids help your brain. The phospholipid bilayer, right? You don't want things to be too stiff. Avoid processed meats and sugary drinks. As we know, these are associated with depression. So can you eat nourishing food, food as medicine, to help improve the quality of sleep you have, the quality of pain that you have? Certainly, yes. Movement, move your body. I think we probably hear this all the time as well. Get at least 150 minutes of, exercise a week. Better if you can get 300 minutes, but I would just say start where you are. Certainly, if you have fibromyalgia and the pain isn't controlled, it's going to be really uncomfortable to move. I remember early on when I did primary care, there was a patient that told me, she's going to be so sleepy. She's going to have a lot of fatigue and be in pain regardless of what she did. So she may as well just move her body. So she went for a walk on a regular basis and it helped her feel better. Being in nature certainly can help, but exercise is really good to help improve sleep and then stress as well. And also, I want to talk about myofascial release. Maybe sort of a newer topic, but if you think about potentially what could be happening if your fascia layer is really stiff, if you're not really moving your body, certainly, I sit behind a desk pretty much all most of the time. I try to do movement as much as possible, but your fascia layer can get really stiff and stretch. And it's better to stretch it out, right? So there actually was a study, a meta-analysis, review of multiple studies, 6 studies in particular that looked at people who did self-administration of myofascial release, either through maybe like foam rolling exercises or different stretching, or with a specific therapist. And guess what? It improved pain, your sleep, and your quality of life. Right. So that is really cool. So, some options here. If you do have fibromyalgia and you have a poor quality sleep, there are probably underlying biophysiological or pathophysiological mechanisms that do contribute to that. I always like to say that your sleep system and your immune system share similar genes. So an insult to one may affect the other. Do you have fibromyalgia because of an underlying sleep condition? Or is fibromyalgia making your sleep worse? It's probably a two-way street. So look for anything that you can improve, meaning look for underlying sleep condition, go get a sleep apnea test. If you have signs and symptoms of narcolepsy, get the sleep test with the daytime napping test. Improve your diet if you're eating a lot of processed foods because they're sort of comfort foods. Eat as many fruits and vegetables as you can. Move your body, and then go see someone that can help sort of relax your fascia layer to help it maybe be a little bit more bendy, and hopefully that'll improve your pain and your sleep. Hope you ladies found this video helpful. If you want to learn more, please hit the subscribe button and share with your friends. Until next time, sleep well.